looking ahead, what do you think will be the biggest challenge facing nonprofit hospitals, and what are you doing now to prepare for that?
Yeah, I think a few things that all of us are facing. Rising costs is one. There's ongoing changes in reimbursement that we are faced with that we have to combat. And so that's why it's so important for us to be active with organizations like the Utah Hospital Association, like our legislators and others who we partner with, so that we can make sure that we're getting the support we need to be able to then in turn provide the care that is needed for those in our community who so desperately need it.
We want to stay viable and serve our communities. One of the things we've been extremely focused on is, what does retention mean to caregivers these days? We spend a lot of time having open forums, caregiver meetings, making sure we're meeting their needs, and build the resources around them too, because they deal with tough things. And then I would also mention models of care. When you look at what a patient needs when they walk into a clinic, they don't always need to see the physician. How do we provide the team support of them? And one of the things we found very helpful is well visits.
I think the biggest challenge facing not-for-profit health providers, such as the University of Utah, is being able to balance the workforce with the rising costs of healthcare, and being able to continue to recruit and retain the best and the brightest to keep those individuals engaged is becoming increasingly expensive. We need to be able to balance that with keeping down the costs, the rising costs within healthcare. We're not only focusing on certain segments of what we offer that create a margin, but we're continuing to provide all the services, whether they create a margin or they lose money. I think that's going to be a major challenge for us and for not-for-profit healthcare providers into the future.